listening to The Scope, a podcast dedicated to having open conversations about healthcare topics relevant to our patients and community. Today we're talking about common COVID-19 vaccine questions. Let's get started. Today our guest is Dr. Cory Offutt, family medicine physician with the Phelps Health Medical Group. Welcome to our first show of 2021.
Thanks for having me.
Yeah, we're super excited to have you back. I know it's going to be a very interesting 2021 with the COVID vaccine now available. So before we get started with our show and our topic of COVID-19 and commonly asked questions, tell us a little bit about yourself. Give us a refresher.
So I'm Dr. Cory Offutt. I practice broad spectrum family medicine over at the Bond Clinic, now the Blues Lake Clinic with Phelps Health. I also go out to the Vienna Clinic on Friday mornings as well as an outreach clinic. I see anything from small children, newborns, up to elderly, all spectrum of medical illnesses, wellness visits, dermatology, you name it. I pretty much see everything.
Now you're also a podcaster with us.
Exactly.
So to kind of kick us off, go ahead and give us a refresher on what is COVID-19.
So COVID-19 is a coronavirus that is very, very virulent, meaning it spreads very readily throughout the community, and it affects pretty much everybody. It causes a broad range of symptoms from mild flu-like symptoms to symptoms that are going to require hospitalization with major respiratory issues. And we don't know a lot about the long-term ramifications of that yet.
Yeah, and we've been in this COVID-19 pandemic since March of last year, so going on about a year. And we've learned a lot since that time period, from wearing masks to not wearing masks. And, what are some ways that we can best protect ourselves from spreading this virus or protecting ourselves?
So hand washing and wearing your mask are by far the most important thing that you can do to help prevent the spread. And then we've all heard social distancing, especially those outside of your own home and close, tight-knit circles, trying to minimize the risks of transmitting it from one person's circle to the other. So people that you're not around all the time, trying to stay just within your own personal circle.
Yeah, in the small group settings, right?
Yeah.
Which is recommended by the CDC.
It is.
So if somebody has COVID-19, how quickly do those symptoms appear? What should we be looking for?
So some people won't have symptoms at all, and so they can be asymptomatic spreaders. And those are the ones that we really worry about, and that's why the mask wearing and hand washing is so important. And then symptoms can take as long, up to 14 days after an initial exposure to even show up. And so whenever your healthcare provider asks you, hey, have you been exposed to anybody with potential COVID-19 symptoms, it doesn't mean in the last 24 to 48 hours, that means in the last 2 weeks.
Yeah, and something that I thought was interesting too with the COVID-19 vaccine is if somebody keeps going into a household that has recently been infected, their time period starts over, right? So every time you go into a house, your risk of infection starts over from that day, right?
That is a re-exposure, yes.
Mm-hmm. Yeah, so I think that's something that people need to know too, is if you have a loved one or a family member that has COVID-19, every time you expose yourself to them while they have the virus, you're exposing yourself.
And so example of that is our twin boys had COVID-19 back in September. They got it at grandma's house. As soon as my wife and I found out about it, with both of us being healthcare workers, we sent them back to grandma's house because everybody there currently had it. Everybody was lucky enough in that household to have very mild symptoms, and because of that, we were able to then start our quarantine day at that point, and then ultimately we're able to get back to work sooner.
That's awesome, and I know that we're very lucky that many of our healthcare workers at Phelps Health have stayed safe. So now that we've kind of recapped COVID-19 over the last 10 months, and just a few short questions. Let's talk about the vaccine, which is new. I know at Phelps Health we've only had it for just a couple of weeks, which is really exciting, and it kind of gives us a light at the end of the tunnel to look forward to with 2021. But let's start off with one question. Is the vaccine safe?
It is very safe. It is actually even considered somewhat safer than a large number of the other vaccines that we have on the market, because there is absolutely no live virus used in the making of the vaccine at all. So all of the parts in the vaccine never came from a virus.
So have we developed a coronavirus vaccine before? What is in it?
So we started research on them back with the 2009 epidemic, and it kind of waned off because the virus didn't really amount to as huge of an issue as what COVID-19 is. And so funding decreased and things like that. So things got held up, mostly in the phase 1 clinical trials. But mRNA vaccines have been around for decades, and they've been researching them for decades. This is just the first time they've really used them in the mainstream.
So can a person get COVID-19 from the vaccination? Because you mentioned that a live virus wasn't even used in the making of the vaccine.
Absolutely not. 100% cannot give you COVID. The best way that I can explain it is that the mRNA is basically the instructions for your body to make its own vaccine. And so it is basically the instructions for your body to code for a part of the spike protein that is on COVID. And then once that is formed, that's the part that your immune system recognizes, and it then forms antibodies to that. So your body's actually making part of the viral particle itself, and not even the whole virus. And that's the part that your immune system recognizes and then makes antibodies to.
Which, Mia, how cool is that our bodies can do that and make that within itself?
It is huge, and it actually opens the door for so many other treatments down the road, for not even just immunizations, but even like cancer treatments and things like that.
So you mentioned mRNA. Is this something new to vaccines, or is this something that we've had for a while?
They've been studying it for decades, and they've been looking at possible cancer treatments with it and things like that too for decades. They just haven't been able to get it out in the mainstream, and then part of that is because of the storage of it. It's more difficult to store. It has to be stored at very cold temperatures, and otherwise it degrades very, very quickly, which is also another reason why the vaccine is so safe, is that all of the parts of the vaccine are actually in and out of your system within hours to a couple of days.
Which is really cool,
It
right?
is.
Yeah. So something that we talk about whenever we talk about vaccines, especially the flu vaccine, is mercury.
Yep.
Right? That's always a really hot topic for people. Is there mercury in the COVID-19
There is
vaccine?
no mercury whatsoever, and even the mercury in like the other vaccines that it's been alluded to is actually the safe form of mercury and not the toxic form of mercury. There's actually less mercury in any of the vaccines than there are in like your common foods that you can consume on a daily basis.
Yes, which most people don't know. So let's digress for a second. What type of mercury is even used in those vaccines?
So there's ethyl mercury and there's methyl mercury. Ethyl mercury is the safe, methyl mercury is the dangerous, and it is actually the ethyl mercury, which is the safe form. Ironically, there's actually methyl mercury in breast milk, which is the toxic form.
Yeah, who would have thought, right?
But there's not enough to even cause any issues.
Yeah, the more you know, Dr. Offutt.
Yeah.
So is one vaccine, we have a couple of them, right? We have Moderna and we have Pfizer.
Yeah.
Is one vaccine better than the other?
They're both around 95% effective. The Pfizer vaccine is approved for ages 16 and up. The Moderna vaccine is approved for ages 18 and up, and that's just because of the age groups that they included in their studies.
So whenever we talk about age groups, one thing that comes up as well is pregnant mothers.
Yes.
Should they be getting the vaccine? Is it safe for them?
So there were no pregnant patients included in clinical trials, and that's just standard. They don't generally include pregnant patients in clinical trials unless it's specifically targeted for pregnant patients. And so each individual patient needs to be speaking with their healthcare provider. In general, it does seem to be safe, but again, that's one of those things that each individual person needs to be discussing with their healthcare provider. I know multiple healthcare like maternal fetal medicine specialists, dermatology and immunologist specialists. A friend of mine that's board certified in dermatology and has her PhD in immunology is currently pregnant, and she got the vaccine. So I know of a lot of people that are getting it, that are pregnant, that are also medical professionals, and other medical professionals who are experts in their fields that are recommending that pregnant patients get it.
So it's completely safe for them is basically the bottom line.
So it is considered much safer than having COVID.
Wow, okay, well there you go. So I know that both of the vaccines, they come in 2 doses, right?
They do.
Why do they come in 2 doses? What's the purpose of that?
So to make sure that we actually have an adequate immune response to it. So it's just like whenever we get vaccines as children, we have booster vaccines. And so that second dose is a booster. The first time you're exposed to it, it's been shown that you develop maybe a 50% response that you would need to fight off a pretty serious exposure and infection. And then the second dose bumps you up to around that 95%.
Okay, so I'll use myself as an example. So I recently, as a Phelps Health employee, have gotten the COVID-19 Pfizer vaccine, and I think like on the 27th, I have to go and get my second dose. What if I miss that date? What if I don't show up?
it's okay if you miss the day. Ideally, you want to do it within that 3-week window for the Pfizer, 4-week window for the Moderna vaccine. But if you miss it, it's okay that it's late. You're still going to have an immune response at that 50% on the first one. Some of that might wane down a little bit, but then your second dose should still bring you up pretty high on your immune response.
Okay, so even if you have both of these doses, you can still get COVID-19, right? It's not protecting you completely.
So nothing is 100%.
Yes.
Absolutely nothing. And the only thing that would be 100% is to make sure that it's not spreading around anymore.
Mm-hmm.
And you still are potentially susceptible. Everybody's immune system is different. How we handle our antibody load is different. And so one person might develop a 70%. That means you're still 30% chance of getting COVID if you are exposed to it. And so everybody's a little bit different.
Yes. So something else that I think is really interesting too is that I am somebody who's also had COVID, unfortunately. Mm-hmm. What is the difference between like antibodies? So my case wasn't super severe. I didn't wind up in the hospital, which was really great for me. Yeah. But as somebody who maybe was in the hospital, does that mean that they have more antibodies than me, or how does that work?
Not necessarily, but it's been shown like the people that have a lesser immune, or like the asymptomatic individuals might have a less antibody response than those that had more severe symptoms. The severity of symptoms also is attributable to their coexisting conditions. So if they are immunosuppressed on medications for like rheumatoid arthritis or cancer or something like that, if they have diabetes, high blood pressure, if they're obese, all put them at higher risk of having complications of COVID as well. And so which leads to hospitalizations mm-hmm. for those patients.
Yeah, so it's almost like a double-sided sword,
it
right?
Is.
Like in one sense it's good because you may have more antibodies, but on the other side, if you have comorbidities, it could put you at a higher risk.
It does. And even if you have had COVID, CDC does still recommend getting COVID vaccine. Mm-hmm. If nothing else, it still would act as a booster to your immune system, promoting a better immune response.
Mm-hmm. So you've talked about immune response as well, and I think this is really important that we talk mm-hmm. about, because even with the flu shot, people get the flu shot and they say, well, the flu shot gave me the flu.
Yeah.
The COVID vaccine gave me COVID. Mm-hmm. That's not true, right?
No.
What is an immune response? What does that look like and feel like?
An immune response is just a person's ability to respond to something that is foreign in your body. So that can even be something as small as a splinter. Like we all get redness and pain around the side of a splinter. And that essentially is the same thing happening whenever you get a vaccine. Your immune system recognizes it as abnormal and sends all of these inflammatory cells and immune system cells to fight it off, identify it, and make antibodies to be able to fight it off if it's exposed again. So that can be in the form of a fever, body aches, localized tenderness and redness, congestion, fatigue, any number of things that you would usually attribute it to mm-hmm. a viral illness. But they are very short-lived. They usually last no more than 3 days after a vaccine mm-hmm. and usually are pretty treatable with Tylenol and ibuprofen.
Yeah, so I almost want to say you should be excited if you get an immune response because it means it's working, right?
Exactly. So my arm was very tender after I got
mm-hmm.
my first dose last week. And so much that I couldn't even lay on that arm that mm-hmm. night whenever I was sleeping. And so the next day I took some Tylenol and ibuprofen and it was gone within an hour or two mm-hmm. and haven't had any issues since.
Yeah, but I had the exact same experience.
And then I've got friends that got the vaccine last week too, and they've got pretty significant fatigue, body aches, fevers, mm-hmm. but they're not concerned about it because that's a normal response.
Yeah, they're excited because we work in healthcare, so to have an immune response, we're like, yes, this is a good thing.
It is a very good thing.
So moving along, with this vaccine, do we know if this is going to be something that we have to get annually, every 6 months, every 3 months?
We don't know yet. There are cases out there where COVID has mutated and caused different forms of the virus, but as of right now, it does not seem to be affecting the parts of the spike protein that we've got antibodies, or that we've got vaccines against. But that's the nice thing about mRNA vaccines. They're very easily changed for those genetic mutations in the virus. And so we could very easily just make that change, and it's very quick to actually make mRNA in the lab and can be done on a high scale.
That's really cool. That's really awesome too, because whenever we think about COVID-19 and the vaccine, do we know when our immunity kicks in and how long that lasts for as well?
So length of time, not 100% known, because again, we've only been doing mm-hmm. this for 11 months now. the immunity usually takes up to 14 days to develop a full antibody response to it. And so even in that 14 days, you still can get COVID even after having the vaccine.
Yeah, so I think that kind of should show people, even though you get the vaccine, you still have to do like hand washing and wearing a mask and social
100%.
distancing and, you know, staying in small gatherings.
And just because you have the vaccine doesn't mean everybody else has. And so everything that we are doing is not just to protect ourselves. It's to protect all of our loved ones, all of our family, and everybody in our community.
Yeah, absolutely. So who should not get the vaccine? Is there anybody on our list that should be wary of getting the vaccine as well?
So it is under the age of 16. It's not approved for because there weren't children included in the studies, and that's for the Pfizer vaccine. Under the age of 18 for the Mrna vaccine. And then if you have certain allergies to certain ingredients in it that are known, there aren't many ingredients in the vaccines. The main ingredients that are in there, they're big long words that people are going to get scared about, are basically they're called nanolipids, and all that is a capsule to encase the mRNA to prevent enzymes in our body from breaking it down so it can get into the cells to actually do what it's supposed to do. And that's all that is. It's basically a transport mechanism. And that's it. That's all that's in it. And so it's broken down very, very quickly after it's recognized by our bodies and turned into the particle of that COVID spike protein so our body can mount the immune response.
So if anything, all of this should encourage us to get the vaccine.
It should.
I always think about whenever all of this started and we knew that the vaccine was coming soon, I thought about the flu vaccine. And I wondered if whenever the flu vaccine was first getting created, if it had this type of craze around it as well.
I'm sure it did. I wasn't around for that.
Yeah, I mean, none of us were, right?
They are looking at potential mRNA vaccines for influenza vaccines as well, because again, they can be made on a large scale very rapidly and be adjusted year to year. And I think that's one of the most exciting things is they can even do multiple vaccines in one vaccine, like multiple viruses in one vaccine, because they can string together segments of mRNA to be able to fight more than one thing at once.
So potentially, and this is just me like dreaming, at one point we could, if this continues on into the future, we could have like a COVID and a flu and a whatever else we need. Yeah, all in one shot.
And then it also opens the door for individualized medicine for people that have cancer that has known certain receptors on it. You can target that individual receptor and not have side effects of chemotherapies.
Which is really incredible because those are things that we've never had access to before, right?
Because right now chemotherapies essentially attack every cell in the body. If your body allows it to pick up the chemotherapy, then it's going to attack multiple cells. That's why people get nauseous and vomit and things like that. And if we have medicines that basically make our immune system respond to only the cancer cells.
And it won't attack the healthy cells, right?
Exactly.
Yeah, that's really cool. That's exciting to me. So I want to talk now about herd immunity because we talk about this a lot as well. And people always say, do I really need to get the vaccine? You know, if enough other people get the COVID-19 vaccine, we'll all have herd immunity. And I think about this, you and I have mentioned this before in a lot of other talks, chickenpox parties. So if enough people just go and hang out and get COVID-19, and my husband, he works like in the construction type field. He goes and delivers a bunch of stuff, and a lot of older men that he works with have all said, yeah, I think I've had it. So it's basically the same concept.
And what I worry about with that line of thinking with like the chickenpox parties and things like that is people that don't work in healthcare aren't seeing those severe patients. If anybody could walk up to 5-10 minutes on our ICU floors in our COVID units and things like that and see how sick these patients were, they would not be willing to get COVID just in the community because it is that scary.
Yeah, absolutely. Well, and I think people don't realize too that just because you've had COVID once doesn't mean that you can't get it again. And I wonder too if maybe if you get it again, your immune system may not have recovered, right?
And we may not know. We don't know how a person's going to respond. There's been only a couple of cases where people have been shown to get COVID a second time, and we just don't know how it's going to work. Yeah,
it's a very fluid situation. I know we've been saying that for 11 months, but I think even into 2021, it will only continue to be a fluid situation.
And I hope that people won't get discouraged from getting the vaccine if it turns out that we end up having to change it and things like that because of mutations. or even if we have to go to year, like we do with the flu vaccine, because the flu vaccines change every year.
Mm-hmm.
And so it very well could be that we're seeing basically another virus that's going to come back year after year that mutates.
Mm-hmm. But it's exciting too, though, because if we have this mRNA that you've been talking about, how cool would it be if we could just have one vaccine versus going in and getting stuck multiple times?
Exactly.
To me, that's way more appealing.
Exactly.
I would absolutely go and do that. So I know that we're kind of nearing the end of our show, but I want to ask you one more question.
Mm-hmm.
As a medical professional, why are you so optimistic about this vaccine?
Because one, it's a huge step forward just in science in general and medicine. It opens the door for so many things, and it allows us to maybe have some, like we said at the beginning, a light at the end of the tunnel of this pandemic, and let us get back to at least a somewhat normal life.
Yeah, I think you kind of hit the nail on the head for everybody in the medical field. So thanks so much for being here
Absolutely.
today, Dr. Offutt, and kicking off 2021.
Yeah.
So thanks so much for tuning into The Scope. If you liked our show and want to know more, check out phelpshealth.org. Thanks so much.